At VERIGRAFT, we have developed a revolutionary technology that allows us to produce personalized tissues for patients. That means we can make fully natural replacement tissues that surgeons can use to repair failing parts of the body and help patients with severe and debilitating diseases. Our patented process starts with a donated tissue segment or with an animal tissue. In the first part, we anonymize the segment by removing all cells and DNA to obtain a completely clean and sterile natural scaffold. In the second part, we use a small amount of blood from the patient to personalize the scaffold and to produce a tissue-engineered graft that perfectly matches the patient. In this way, we can produce real tissues that do not appear foreign to the body, that are not rejected, and therefore do not require the patients to take immunosuppressive drugs with serious side effects for the rest of their lives. The technology was made possible through the bright minds of a group of innovators and through years of diligent research and development. We now design the first product based on our technology as a therapy for patients suffering from severe chronic venous insufficiency. The disease is caused by the failure of valves in the deep veins of the legs that normally open and close and prevent blood from pooling in the lower parts. Valve failure leads to severe and very painful swelling of the ankles and calves. Over time, the skin starts to deteriorate due to the lack of blood flow, and the patients develop non-healing deep ulcers that require continuous wound care to prevent infections. Millions of patients are suffering from this lifelong disease that takes away their quality of life and often leads to long-term inability to work. Today there is no cure. The therapy we developed to help these patients is a personalized vein graft with a natural functional valve that opens and closes to prevent reflux of blood. In a simple procedure, the surgeons use this biological spare part to replace the problematic segment of the patient's vein that has a broken valve. The healthy valve in VERIGRAFT's personalized graft restores normal blood flow and venous blood pressure in the leg, and the clinical symptoms rapidly start to improve. VERIGRAFT's first clinical trials are demonstrating the safety of the treatment and allow us to observe the clinical efficacy of our personalized, tissue-engineered vein graft. We are developing additional products to treat failed arteries, failed coronary vessels, and heart valve disease. Imagine the transformative impact when surgeons can transplant fully natural, personalized replacement tissues to treat seriously ill patients.